Coming up in today's video, guys, we've got one patient who has completely different wax in both ears. My name is Taylor Green. I'm one of the audiologists here at Audiology Associates. And what you're looking at here, this is Katie's patient. Now, I would imagine feeling very blocked up looking at these ear canals. So we've got this kind of sticky, like really thick type of wax in this side. It's obviously a very old type of wax as well, and we can usually tell by looking at the color. Now, wax in general, a lot of the time is like a orangey sort of light brown color, but wax when it gets older is very similar to when you cut an apple and you leave the apple on the side for a little while. It goes from that whitish color to like a really dark, kind of horrible brown color. And it's the same with wax. The wax can oxidize, and the longer it's been in the ear canal, the darker it can go. So, you know, in some cases I've removed wax that has been black in color, completely like coal. It's the only way I can describe it. So Katie's got the standard size ulnar tube here, which is the larger of the suction tubes that we use for most of our procedures. So far, so good. It seems to be coming away okay. And this does look like it's one whole piece of wax here. It doesn't look like it's loads of, you know, little scattered bits. So I think what Katie's hoping here now, and what I'm hoping is going to happen, is this whole piece is going to just unstick from the ear canal and all come out in one go. It's a very deep plug as well, this one. There we go. You get that starting to come away. I think that's going to break away though. I don't think that's going to be the whole. No, it's just broken away. Okay, yeah. You can see there's a lot of hair as well mixed in amongst all this wax. So quite likely patient has over time been potentially using cotton buds as well. Maybe not recently, because it didn't look typical of a recent use of cotton buds. Because sometimes we tend to see those, you know, flat surfaces. We tend to see, you know, big dents in the wax. But this was quite like spiky in a way. There wasn't really any obvious kind of sign that that's been in use. So you can see Katie's just giving it a little bit of a wiggle here now, just to try and loosen the rest of this plug up. There is some dead skin, some like dry skin that is still stuck to the ear canal, and I think that is potentially going to stop Katie from getting this out nicely. I might be wrong. Oh, it's almost there. Yeah, break that a little bit away. Okay. Yeah. So this is, we are essentially right up against the eardrum here now, so we've got to be super careful when we're peeling these bits away. You can see it almost looks like the patient has been using some form of oil. There's a bit of wetness I can see to that wax at the bottom of the plug. We do suggest our patients to use, if possible, we do suggest our patients to use some oil before coming in for an appointment. It does make the process a lot easier. And you can see to the right hand side there, you can see a white, oh, it's almost like yellow, that is, and then that's a layer of new skin. So like not new skin, but newer of the dead skin, if that makes any sense. So a skin that's just migrated and has tried to push that wax out but just hasn't been able to move, so it's obviously disconnected from the ear canal and it's just kind of stuck to the back end of that wax there. They're a bit of a pain, these sticky ones. Now, me personally, what I would do here at this point, I would pop a load of oil in, which usually after I say it, Katie normally does it, to be fair. I pop a load of oil in to try and change the consistency slightly to enable us to get a better grip, to pull that whole thing out in one go. Oh, Katie's getting lucky here though. Yeah, there we are. No need for oil in this case. Oh, it's quite a big piece as well, actually. So you can see as that like ball of wax pulled forwards, it's pulled forward all that dead skin that's been trapped behind that wax. That's all that white material you could see at the back that's attached to that wax. The patient immediately would have felt relief once that unplugged. So they normally mention, well, you know, once we've taken big plugs like this away, patient sort of goes, oh, you know, it's a massive relief, and they're like, oh, I can hear again. So yeah, Katie's going to try and just clear these little bits of skin up. Quite risky, not risky, but especially with patients who have come into us, or especially having wax removal for the first time, we always try to keep it as comfortable as possible for the patient. And what I mean by comfortable, I don't mean like pain or discomfort, but I mean noise side of things, because once that wax is cleared, the suction tube can become quite noisy. And you could see there was a little patch of dry skin to the left hand side of the eardrum there. It would have been very difficult to remove, especially if the patient's a little bit kind of, you know, not hesitant, but flinchy. It's the only way I can describe it. So you can see now, Katie's mentioned on this video that both sides were completely different consistencies. And I can see what she means, that the right, I think it was the right hand side, the other ear, I'll say, basically had this kind of harder consistency. It was a bit more of a like full structure, whereas this one, it's a little bit more brittle, and it's kind of not brittle, what's the word, it's soft enough to the point where it's just breaking little bits away, you know, really easy. So Katie's trying to do the same process, peel it off the sides, and that should loosen that deeper plug. The problem we get when you use oil, so especially if the ears are completely full like this, in some cases, if the wax is hard, the oil that you use usually only affects about half of the plug. If the ear is completely full, what we find is we get this softer kind of, this softer section right at the front. So we manage to break away and clear that nice and easy, and then right at the back you still have that harder kind of core, which the oil hasn't quite affected. But this again is a load of skin in here. You can see this darker section here, this is the wax, and all this lighter material at the back here, this is all the skin. It looks a bit more stretchy in this ear canal. Yeah, very difficult. Fair play to Katie. It's a very difficult consistency to remove. Oh, we've got the gap. Ooh, Katie's going in with a curettage here now. Yeah, I was going to say, I think that's just going to break away that front section. Yeah. This is going to at least give us a little bit more room to bring the sides in here. Yeah, no, it's not really doing a great deal there. So again, I think looking at this one, me personally, I would have again myself gone in with a little bit of oil, which Katie probably does in a second. You can see the ear canal is uncovering quite nicely as she's peeling that away towards the center of the ear canal. There we are, there's the oil. So you can see the difference that just that little bit of oil has made. As soon as that gets around that skin and it starts to, you know, it almost acts like a slide. You know, it's like grease. It's just going to allow us to slip that wax out a lot easier. But unfortunately, it is left with this little layer that's kind of stuck up against the front of the eardrum. Yeah, nice. Yeah, great. The eardrum is looking really good. Katie's going to try and get this little bit that's left here. Yeah, you can see that just with that noise, that little tiny bit that gets sucked into the suction tube. Patients had a little bit of a jump, which is kind of what I meant on the first ear that you saw in the video. So yeah, this is just a little tiny bit. Yeah. So what we'd normally, oh, it's a bit of a messy one, that one. We've got just over 5 centimeters there. So we would normally advise the patient to use a little bit of oil, you know, following the procedure where you see those little tiny spots left. That oil is now going to be able to get straight over the surface of those little tiny bits. And, you know, after a couple of days, you should find, you know, little bits will start coming back out naturally by itself. If you enjoyed the video, guys, don't forget to like, heart, share, follow, and subscribe. And yeah, you shall see myself and hopefully Reese, not on the next video. It's going to be myself on the next video, but you'll see us hopefully next week. And don't forget to take care of yourselves, take care of your ears, and take care of one another. And we'll see you on the next video. Thanks, guys.